Give the call to the honourable member for Kennedy.
Health Minister, are you aware that bone marrow registration has shrunk? Yet recently 300,000 private funding tripled registrations. Overseas donor tissue cheek swab programs introduced here with publicity, uni colleges, military, public service, donor age up to 40. Minister, couldn't we save 1,000 lives? Bonnie Black battles for a life in Charters Towers. 14-year-old Maggie at Cronulla. Too late for 13-year-old Missy at Malanda. 4-year-old Robbie, little sister Sophie, pray to Jesus for their dad, Liam O'Brien.
Give the call to the Minister for Health and Aged Care.
Thank you, Mr Speaker, and I thank the member for Kennedy for his question on this very important health challenge that is facing so many Australians. I also want to thank the member for, first of all, bringing this issue to my attention yesterday, but also arranging our meeting that we had together with Liam and Josephine, as Liam faces a really difficult battle against leukaemia. And Liam is not just in the fight of his life, for his life. He and Josephine have brought enormous energy and time and resources, fundraising, media appearances to draw attention to an area of healthcare that frankly has moved too slowly in this country. So I thank him for his question today and for that engagement over the last 24 hours. In his absence, I also want to acknowledge that the Chief Opposition Whip, the member for Ford, and I had a discussion about this issue in the chamber just yesterday afternoon. As the member knows, and many others will, bone marrow donations provide the stem cells that are required for stem cell transplants, some life-saving treatments today for people who are fighting leukaemia or a range of other blood cancers. It's clear to me, though, that Australia has not moved fast enough to enable more effective matching of bone marrow donors with patients like Liam and so many others that the member mentioned in his question. It's also clear to me that our bone marrow donation system in Australia is too small. There aren't enough people on the registry. It's too slow, and it's not kept up with international standards, including on things like cheek swabs and age limits on donors. We know that cheek swabs are an effective and very economical way of bringing additional donors to the registry and giving people like Liam and so many others a different, better chance at life. Used across the world, this is not a system that's yet been introduced in Australia. What isn't clear to me, though, is why Australia has moved so slowly over the past decade in particular, compared to some of the other countries that Liam and the member and Josephine mentioned to me yesterday. It seems, as unfortunately is so often the case in health policy, that part of the problem is that no single government between the Commonwealth and the states and the territories has sole responsibility or sole authority to make sure that Australia keeps pace with the rest of the world and these advances in technology. And frankly, as the member knows, as I think all members know, in cases like this, that's just not good enough. So after my meeting with the member for Kennedy yesterday and Liam and Josephine, I'm writing right now to the Chair of Health Ministers to seek their agreement to cut through some of this jurisdictional bureaucratic red tape, to do everything we can that is to clear the way that is currently denying patients in Australia the best chance to access this life-saving technology. Yeah.